in terms of reimbursement, how does that work for telemedicine?
Definitely, we can get reimbursed. And so I kind of like think about this as what's going on at the federal government level. And they've kind of issued well, who can practice telemedicine and who can't. But what's interesting, like reimbursement for medicine in general, this is a web of complexity because there's what's going on at the federal level, and then each individual payer almost has different policies about who can perform what services remotely and what those services actually entail.
What are some of the core factors in determining telehealth reimbursement?
Well, it's interesting, Drew. This actually may be a good time to bring up the fact that telemedicine is actually only one of a series of digital services that can actually be provided today. So, telemedicine has a specific definition: two-way interactive audio visual. So, again, two-way interactive audio visual. And sometimes you'll see the government add the term real time as well. But actually, there are lots of other services that can be rendered and paid that are not technically telemedicine. You see, historically, telemedicine was only allowed for patients who were in a healthcare professional shortage area. That is, there weren't enough doctors available, so they were able to see physicians who could bill, from the cities, if you will, for those patients. But obviously, it was pretty restricted. So now we have services that are telemedicine, and they kind of blew up. I say the federal government said, listen, a patient can be anywhere. But in addition to telemedicine, we actually have e-visits, remote patient monitoring, and virtual visits. So I like kind of think about these collectively as digital services. And the key really factor in determining which of these is how they are delivered. So for example, if you service a patient over the portal, you can look at the codes for e-visits or virtual visits, but you can't bill telemedicine because it doesn't fit within that two-way interactive audiovisual definition. And of course, the other factor is what is delivered, what services that is. And that's where I would actually suggest looking at the CPT codes themselves to determine. And in fact, I should mention that the American Medical Association has an amazing fact sheet that kind of goes through the different scenarios and offers you guidance about who can bill for it and what they can bill for. So that's something I would highly recommend to physicians.
How does payment work?
Let's take a look at telemedicine first. For Medicare, there's actually more than 200 codes now that can be delivered over telemedicine. So your traditional evaluation management codes like 99213, or even annual wellness visits. And interestingly enough, they are paid at the in-person rates. So let's say you got paid $75 for 99213, which was kind of a very close to the national payment rate from Medicare. That's what you'll get from telemedicine. So that's awesome. But for the other digital services, and CMS actually uses the term communication-based technology services, or CTBS. I know we need another acronym. But from a Medicare perspective, they kind of range from about $12 to $15, and the highest you're going to get is like $50 to $60. So, I'm not going to list off all the particular reimbursement, but you can just tell from my example that it is definitely more favorable for you to actually bill for a telemedicine visit. Now, I'm giving those figures from a Medicare perspective, but each payer has, of course, their own fee schedule, and you'd want to look to them to see what's the most conducive for you, and of course, to be compliant, to actually render the services appropriately.